Hi there, Dr. Bruce Pinker here, just to talk to you briefly about a very common topic in modern day podiatric medicine and surgery, and that's called custom-made orthotics. So what are custom-made orthotics, you say? Well, they're medical devices that are designed to address orthopedic conditions of the foot and the ankle and the lower extremity, and they're prescribed by a doctor. So it's not what you would find in the store or order off the internet that comes in a package that you might put inside your sneakers or shoes. No, those are just cushions or arch supports. Custom-made orthotics are medical devices. They have many different applications for many different types of conditions. Does everyone need a pair of custom-made orthotics? Absolutely not. There are many people with normal feet. They have no abnormalities and they don't need custom-made orthotics. But there are many conditions of the foot and ankle for which custom-made orthotics can be applied to address the concerns of the patient. And here are some examples. This is a rigid type made of graphite, and it has a leather top cover, and it has a metatarsal pad built in here to address pain at the ball of the foot. And these are very effective for people that wear dress shoes, even for men and women. This one is a thermoplastic device here. It's very somewhat flexible, very sport-oriented, with a plastizote cover here. And the plastizote is for people with diabetes. It can address some concerns. It's very supportive to the diabetic foot. It has a metatarsal pad built in to address the ball of the foot concerns. These are good for a sneaker or a hiking boot. And this one here is also graphite, with the plastizote as well, for someone with diabetes. These are for a man who has a need for dress shoes. They fit well in a dress shoe, also in a sneaker, and we operated on him a few years ago, so he wants to get a new pair each year. There's a special modification here called the Morton's extension that addresses arthritis in the big toe joint, a condition also known as hallux limitus or hallux rigidus. So we make a new pair of orthotics for this patient just about every year because he wants to take good care of his feet and he's a diabetic. These are made over the shell, graphite. They fit well inside many different types of shoes. They're made for a woman. This is a leather top cover. Some people prefer them to be made at this size. This one is also sport type, thermoplastic, but it has a special cover that's Spenco-like. It's just like Spenco. It's injected with nitrogen bubbles, and it's very cushioned, supportive, and shock absorbing, and these are good for athletic activity. Now, there are a couple of other types not shown here that we do commonly provide for patients. There's one for high heels, for women's high heels. It's very thin, it's a lighter type of orthotic. And for children who in-toe, there's a way to address that with something called a gait plate, and that works really well. Now, there is a condition that really is not appropriate for orthotics, and that's a hammer toe. So if someone has a painful hammer toe, it should be addressed surgically, and we do correct a lot of hammer toes surgically. But there are many other conditions that can respond well to a good pair of custom-made orthotics, such as a neuroma, which is pain in between the toes, or metatarsalgia, bursitis, pain at the ball of the foot. Bunions can be addressed with an orthotic, but it's not going to cure the bunion. It's not going to remove the bunion. We can address the biomechanical concerns so that the bunion doesn't progress anymore. Painful bunions, though, should be addressed surgically, and we do operate on a lot of bunions. We do correct a lot of bunions surgically. There are a couple of other conditions that respond really well to custom-made orthotics, and that's heel spurs and plantar fasciitis. So there are quite a few. And let's review that these are custom-made devices. They're medical devices. It's not something that you're going to purchase on your own from a store, and they're designed very specifically. And these are addressing the foot and ankle concerns and even issues in the lower extremity. And we find that we can accomplish this to address these concerns in a very simple, effective, and conservative manner.